Now that we have read about the P wave in a normal heart and the P wave in case of a right atrial enlargement, it's time to see what happens to the P wave morphology in case of left atrial enlargement. So just like we did the P wave changes in the frontal plane and horizontal plane in case of the previous So just like we did the P wave changes in case of the frontal plane and the horizontal plane in case of the normal P wave and the right atrial enlargement, we'll be doing the same way for the left atrial enlargement. So coming on to the axis. So the axis of the P wave is shifted to the left. Therefore, the P waves are taller in lead 1 than in lead 3. So this is an important point here that the P wave is going to be taller in the lead 1 as compared to the lead 3. So if we talk about the P wave in case of a normal heart, the P wave in case of lead 3 is larger than the lead 1. Why? So now if you look at the figure drawn at the right upper corner of this page in pink, you will see that I have drawn leads 1, lead 2, AVF and lead 3. And we just did recently that the normal axis of the atria is around 45 to 60 degrees, that is somewhat over here. Okay, so therefore if you see that the lead 2 is the best lead to look for the P wave morphology because it's directly facing that vector and hence it will be recording the maximum current. Also in general, if you see the leads given here, the 2, 3 AVF are the best leads to look for the P wave morphology as compared to the lead 1 because it's not in the direction of the current and it won't be able to record those minor changes. But when we have left atrial enlargement, there is going to be the shift of the axis towards this side and lead 1 will become a favorable lead to look for the change in the P wave morphology. Okay, so the axis gets shifted to the left and the P waves in the lead 1 will be taller than the lead 3, but this is not the case in case of a normal heart in which we will be having taller P waves in the lead 3 as compared to the lead 1. Now coming on to the contour, we need to know that the P wave is bifid or M-shaped. Okay, so if you look at the figure above, you will see that this is an M-shaped or a bifid P wave. So the first hump represents the activation of the right atrium and the second hump represents the activation of the left atrium. So these two humps are separated by at least one small block and are best seen in the leads 1, 2, AVF, V5 and V6. Okay, so if you want to see the P wave morphology in case of left atrial enlargement, we will be looking for the leads 1, 2, AVF. In case of the right atrial enlargement, we were looking at the lead 3 and not lead 1 because the axis shifted towards the right side. But now in case of left atrial enlargement, since the axis has shifted towards the left, we will be looking at the lead 1 and not at the lead 3, and the leads 2 and AVF will stay the same. And because the leads V5 and V6 are located on the left side of our chest, they will also become favorable leads to look for the P wave morphology in case of left atrial enlargement. So the P wave in case of left atrial enlargement is often called P mitral. In case of right atrial enlargement, we were calling it as P pulmonale. So can you think of why are we calling the P wave in case of left atrial enlargement as P mitral?
Because mitral stenosis has been
known to be one of the most common causes of left atrial enlargement. Hence, the wave is called P mitral. It doesn't mean that every time you get this notched or a bifid or an M-shaped P wave, the cause of the left atrial enlargement is mitral stenosis. It does not mean that, but it does mean that it's one of the common cause. So coming on to the amplitude, the height or the amplitude of the P wave is not significantly prolonged. Okay, so it is not prolonged. And coming on to the duration or the width of the P wave increases than the normal, which is 2.5 mm or 2.5 small squares. So I just want to correlate the amplitude and duration with the P wave changes in case of the right atrial enlargement. So if you see in case of the right atrial enlargement, we had a change in the amplitude but not duration. But in case of left atrial enlargement, we are having a change in the duration but not in the amplitude. So just try to correlate and remember this. So now why is there an increase in the duration in case of the left atrial enlargement? The reason for that being is that when the sinus node is going to generate an impulse, it's going to take a longer time for the impulse to reach in this enlarged portion of the left atrium, which is presented by this green line. Hence, the duration will be prolonged. But when we talked about the right atrial enlargement, we know that it's also going to take a longer period of time, but that will still coincide with the impulse that will be traveling towards the corner of the left atrium. Okay, so it would not change the duration, but the duration will be changed, rather increased in case of left atrial enlargement. So now talking about the P wave changes in the horizontal plane, we know that a normal P wave will be upright in the leads V3 to V6 and in the lead V1, and often in lead V2 it can be of 3 different morphologies. In case of left atrial enlargement in lead V1, the P wave is biphasic or inverted. Okay, and the inverted portion measures equal to more than 1 mm in depth and equal to more than 1 mm in duration. Okay, so if we try to correlate it with right atrial enlargement, we know that in that case, in the lead V1, there will be peaking of the P waves with increase in the amplitude sometimes, but the inverted portion of the waves will not change. Here, we will have biphasic and inverted waves, and the inverted waves will actually increase in size. They will become equal to or more than 1 mm in depth and duration. Whereas in a normal ECG and also in case of the right atrial enlargement, the inverted waves were less than 1 mm. So if we see the figure above, we can see the P waves given in the lead V1. We know that the type of morphology that we will be seeing in the lead V1 is gonna be terminally inverted or totally inverted. Okay, and the inverted portion will increase in size, that is, it's gonna be more than 1 mm in depth and more than 1 mm in duration. So just like I compared the right atrial enlargement with the normal P wave, I'll be comparing the P wave in case of the left atrial enlargement with the normal heart. So when we talk about the frontal plane in the lead 2, what do you think will be changed in the case of the left atrial enlargement? We know that the contour of the P wave will change. It will change to bifid or M-shaped, and there will be increase in the duration. But the amplitude will not change. Okay, this was something that was reversed in case of right atrial enlargement, in which the amplitude increased, the waves became more peaked, but the duration did not change. Okay, Now, when we talk about the precordial leads, especially lead V1, we know that in a normal heart, in the lead V1, the morphology of the P wave can be upright, biphasic, or inverted. In case of the right atrial enlargement, we know that the upright portion of the wave can be a little bit more peaked or pointed and taller sometimes, but the inverted portion will stay the same, and it's generally less than 1 mm in either direction. Whereas when we talked about the left atrial enlargement, the type of the morphology that we will get to see in lead V1 will be either biphasic or inverted, and the upright portion will stay the same just like in a normal P wave, but the inverted portion will actually increase in dimensions to equal to more than 1 mm. So now coming to the direction of the left atrial enlargement. So in the frontal plane, the left atrium will enlarge towards the left side, which is the reason why we have the shift in the axis of the heart, which is gonna be to the left of plus 45 degrees, okay? And that is the reason why the lead 1 becomes a better lead to look for the P wave changes as compared to the lead 3. Because this is where the lead 1 is going to be, and this is where the lead 3 is going to be. So lead 1 is obviously closer to the flow of the current and will be able to detect all the changes. And in the horizontal plane, the direction of the left atrial enlargement will be posteriorly. Okay, so this is a 12 lead ECG showing the left atrial enlargement. So how do we know that it's a left atrial enlargement ECG? So if you look at the lead 1, lead 2, lead AVF, which are some of the best leads to look for the P wave morphology in case of the left atrial enlargement, and also the lead V1, we will be able to see the changes that we have just talked about. So you can see the notching or the bifid P wave. This is the enlarged view seen in the lead 1. This is the lead 2. Again, you see that the P wave is kind of like M-shaped, bifid, kind of notched. Then also in the lead AVF. And when you talk about the lead V1, you see that the wave is inverted here. So which other type of morphology can we see in lead V1 in case of left atrial enlargement? We can also see a biphasic one. And how do we differentiate it from the normal? If you see that the portion of this inverted wave is actually more than 1 mm wide and equal to more than 1 mm in depth. Okay, this is what happens when there is left atrial enlargement. The inverted waves will become bigger.